I'm Professor Elijah Ogola from Kenya. I'm here in my capacity as the president of the Pan-African Society of Cardiology. I thank the leadership of the Cardiological Society of India for inviting me again. They invited me last year, and we are in the process of building collaboration between the cardiovascular communities in Africa and India. The topic of the theme of this conference, which is from prevention to intervention, is of course very pertinent to both our environments in Africa and in India, because these are the environments that are seeing the greatest rise in cardiovascular diseases. I gave my talk on a session that was very aptly named Cardiovascular Prevention by 2030, Beyond Balloons and Stents. And what I focused on in my topic was to highlight the fact that to a large extent, cardiovascular diseases are due to preventable risk factors. And that by the time we get to the cath lab and we are using balloons and stents, basically the cause is lost. And the fact that the biggest job should be in primary and primordial intervention. One, because it is best for our populations. Two, it is the cheapest way of managing cardiovascular diseases, because when you get to interventions, it is expensive. The second aspect that I focused on is that it is not just enough to have fancy high-tech solutions without having the health systems in place that facilitate the utilization of those institutions or facilities. So that in attempting to control cardiovascular diseases, it is important that we have to look at the whole health system holistically. Patients know when they have heart disease so that they come early. There's good transport to get them to the hospital in good time. The healthcare workers, especially primary healthcare workers, are aware of these things so that they can make a timely diagnosis, and that the facilities, especially in the public hospitals, have the capacity. So I thought that was quite an interesting discussion for something which is common between sub-Saharan Africa and India. I've enjoyed myself in the conference, and I'm looking forward to coming again next year. Thank you.